Hi, my name's Borysiewicz. I'm a consultant dermatologist, and I thought that I'd come to you today to run through some of the brilliant questions we had on the Mumsnet thread talking about eczema. Hopefully we can whiz through some answers with you and you'll be able to help manage your kids' eczema better. So let's get started. Can you advise on what's best for bathing a child with eczema? Bath time can always be a bit of a struggle, and I know this as a mum. But when your child has eczema, there's a few really simple rules to follow. First of all, avoid soaps. Soap products are going to strip all of those lovely natural oils from your child's skin. So remember to use soap substitutes or Syndets such as Lipicar Syndet. As well as maintaining the skin barrier, they're not going to strip the natural oils, and they're also going to have additional moisturising benefits for your child. Keep bath time a relatively short time and make sure the water isn't too hot or too cool, somewhere in the middle. Once the child's out the bath, a quick towel dry down and a thick layer of moisturiser, and then you're good to go. What is the best thing to put between the baby's creases between bathing and at night to help with itching? So creases are a particularly tricky area to try to manage. After every bath time, it's really important to dry those areas very thoroughly, as if things get too moist and sticky, often you can have an overgrowth of yeast in these areas. And then apply a nice layer of moisturiser, products such as Lipicar AP+M. If you're worried that your child's skin is becoming red and sore, it's important that you see your doctor to see whether they can provide an anti-inflammatory cream with also an additional anti-yeast component in it. This will help to deal with any superficial infections. You also mentioned nighttime itching. This can be a really big problem. Make sure that you try to start your nighttime with a nice cooling bath, and make sure that after the bath the skin is well moisturised with light pyjamas. Try to stick to natural fibres so that the skin can breathe through the night. Next, look to your child's bedroom environment. Try to keep the temperature on the cool side, and also if you do need to have a radiator on over the winter months, think about popping a small Tupperware pot of water just next to the radiator, as this will help balance the humidity in the room overnight. What is the best course of action for dealing with eczema or dry skin on the scalp? Scalp eczema or cradle cap in children is really difficult to manage. It's also very common. We call it seborrheic dermatitis. And this is because it seems to occur in bits of your body where you have a particular presence of yeast on the skin. When you're dealing with particularly difficult scale that's adherent to hair, it's worth thinking about soaking off this scale with an olive oil. Leave it to soak for 5 or 10 minutes, but it's very, very important to shampoo this out very well with a fragrance-free light shampoo that's suitable for babies. Please could you recommend a cream for targeting inflamed eczema on hands and body which works in the winter, as well as something lighter and everyday for all over after the bath for the children? A lot of moisturising products contain a mixture of grease and water. For everyday use and for after the bath, think about using products like Lipicar AP+M. This is well tolerated, soothing, and sinks very quickly into the skin. For winter months, you may want to look for more of the colourless barrier creams such as Cicaplast. These are richer and also protect the skin from chapping and are particularly useful for exposed areas such as hands and lips. Winter's a really difficult time. Lots of central heating, lots of temperature fluctuations, and the weather can't make its mind up. This is really where you need to focus on getting as much moisture as possible into their skin. You might want to start thinking about your child's healthy skin microbiome. This is a collection of healthy bacteria and organisms that live on everybody's skin. Look for products that maintain that healthy skin barrier, but also respect the microbiome of your child's skin. Products such as Lipicar AP+M. I hope that was helpful. It's been lovely speaking to you all today. Remember those few key points. Avoid soaps, stick to soap substitutes to not strip natural oils from the skin, and always remember to apply plenty of moisturiser. With those tips, you can't go wrong. Thanks again, and remember, subscribe to Mumsnet.